Awesome. Some things get to play. Especially if you wanaogopa mimba kushinda ukimwi. Kushinda ukimwi. Now every time we talk about teenage pregnancy, every time you see a pregnancy or a pregnancy, that's a sign of what? Oh yeah, being pregnant. We say HIV doesn't affect economic status, but I think the informal thing in Kisumu affect more the HIV than maybe is 12 years old. Yeah? Kupatia mimba si ndio? Na sisi vijana vile vile kuruka. Si ndio? Hayo si especially our government is because I tell them Baba young people, sex is not an emergency.
National Syndemic Diseases Control Council. Kuna kitu wamesema ya vulnerability. Nitairudisha baadaye kwa Daktari Otieno. I know you na unaweza elewa hao wasichana kidogo na utuambie. Kuna kitu inaitwa wababas. Ni wangapi hawana hapa?
Branch. A group that you know, and they play a vital role towards the prevention of HIV. You have got student leadership, you got of the problem. What kills people is opportunistic what? Infections. And opportunistic infection is good for one people, for one man. A man will die fast. Why? Die fast. And ladies, number two. Why ladies are more infected than men? The last of the ladies. This one makes them move with other people because they want so much.
Thank you. Amerusha mwenzetu ameweka na which I feel pia tunafaa kuziangalia clinically. I'm not disputing the point, but kuna madaktari hapo wanaweza changia zaidi. Dr. Ombole,
4%, but for women it is 5% for men. We are aware body count. I know men have more body counts than something we talked about, the anatomical difference between a man and a woman. No difference. You are likely to get the virus, anatomical difference. So it should be you. Staining or use of PrEP or use of PEP, you should be the one. Because a man can go with an infected lady, but let me tell you, for a lady, if you go with an infected lining, is a mucosal lining enter your body. So girls, please, and women in general, if you don't trouser, you will get infected. So that is why one man who is positive will infect very many ladies, and like one infected lady.
Asante. Yes, as a daktari anaenda kuongezea, I also emphasize on what Dr. Ombole said. Na kuna wengine mwanaume alilala na mwanamke na asikie ukweli ni mgonjwa. Is positive. Ametestiwa kila mahali anaambiwa you are negative, lakini hataki kukubali.
Because of just to add on what Daktari said, anatomical differences, there is also the issue of socio-economic inequalities. We are still at generally speaking, you find that women have socio-economic getting in risky sexual behavior. They have lower power of negotiating for simply because of even the age differences. If somebody is elderly with a young girl, the girl
Yes. Nikiangalia mkutano wetu leo kuna the family. What is our role? Wamama, wazazi mko hapa na yes. So then, when you are seeing a young man define ilikuwa sustain huyu mtoto wewe yenye anapatikana huko kwa college. Where do you think as level when these kids or when these teenagers are coming with problems to us, how are we addressing these guys? Akikuletea hiyo unawaambia usiniletee hapa. Hivi kazi yako ni kutafuta visi wewe upatikana wapi? Kwa shule. They cannot. So I'm saying and I'm echoing that our roles as parents, we must sit on it and sit properly and address the issues of our children.
Yes.
Dr. Oscar.
Nilikuwa nimekurushia hiyo swali because now she's the psychologist.
Thank you. Listening to my colleagues responding, we realize that as we talk about biology, you know, the biological aspects, mental health cuts across. And mental health becomes very key. I think the answers are clear. Vulnerabilities that we find in women. Basically, even in terms of mental health, women remain vulnerable. So, young women who are princesses, I say this boldly. Sex takes place, and therefore that predisposes you to infection. I want to add also, besides all that has been said, I also want to remind the ladies that you are also vulnerable to gender-based violence. When you go for these parties, bashes, please, you remain very vulnerable. Because I know if men get raped, yes, but if you look at the statistics, more women get raped than men. So then, in terms of style, they are always willing to spread it. So you will find more women at the women are vulnerable. Knowing that we are vulnerable, we just have to take care of ourselves. Now, in terms of that, men are poor in help seeking, could be also affecting in terms of statistics, so that you find that there's a man somewhere who is infected, but because this man has no sort of mental health seeking behavior compared to men. So, seated here, I'm sure if you seek help, you will always get. Find somebody to. And it has also been mentioned that suicide rate is higher. Go out and seek help, including mental health services as well.
Remember this message is brought to you by Keti. Keti, nani anajua Keti ni nini? Sasa hiyo sitawauliza. It's endelevu tuasisi ujumbe ule. Bali ni sawa. Now, naambiwa kuna wenzetu ambao wanapima. Kama unataka kujua hali yako, usiogope. Wamefika, wako huko nje. Na leo kila mtu ako hapa. Tutoke hapa tukijua hali zetu. Au vipi? Sivyo? Hali yako, ende upimwe, majibu utapata kisiri na alright. Hapa mama mara na wataka. Bakanje take maikiete sawa inambara na watata tumanyenga mbabuwa tikito kwa na wana wase kita ndiana wali swali simutaniruhusu pia tuende na wao awa ni wami iko tuwate wanga mbarabi bara saa tari mono seba oru Musat sababu na yese na hivi mura changia kile kile ndio
sababu na hivi kwa sababu ni kari waitu watu manyaki utu kwa
yes
ngama ina basacha wako ni urogo baile.
Yes.
Be musimoyo. Be chuara na after all. Na kule tini kukunche wake.
Good.
Nige ndokende. Tari bango. Bagenda sini churu.
Yes. Kwa trilions, ingo komenta. Ngero munoli wete ya radio. Wa, oyo.
Abagaka, igo bakwebisera n'umugore igo bagana kwebisera bari kutaka basokia o tangbalwali.
Yes.
Lakini abana barabwa ngweso tulikuwa bimwa tu amanyuma tulwali.
All right. Wanginonara komenta hapo? Nara uweke ujumbe ya sana as we prepare for other questions. Yes, Omoni. Mbali kunyo? Kaya, yindu ayete wako usine yao. Mbali good. No, Biaona sana. Thank you so much. Yeah, 1 minute. We move.
Thank you for the opportunity. I'm Witi Amamsutino. I'm a scout and I'm also to the workshop HRC. A lot of parents in combating HIV/AIDS when it comes to the youth. So, for example, when we're talking about how this thing goes. So, when you look at how parents handle their children, they are parent friend before I open up to you. Yeah. When I'm talking about being a parent first before being good, before they know if what I'm doing is good for me. That is what I'm saying. So what are you guys doing, even in hospitals, to ensure that our parents also get that education, also learn from them? Because when I come to school, like for example right now, my parents, I have not listened to my parents tell me about HIV/AIDS. Get settled on me. Get settled on me. Number two, and this one is you are talking there, and I can't see someone who I can reason with.
Those are very brilliant points. Those are very brilliant points. You say your Otieno? Okay.
Issues that you have raised. You know, if we are to win this war on any all the issues, we have to really engage them, and they have to be equal partners. So, going to the issue you have raised about we are Gen what? Actually, you know, we always have in a different environment whereby we want solutions, but then this issue of adolescents and young person, the church has their role, the schools have their role, so improving their well-being and their welfare in society. In Keti County, we have NGOs that have taken some work in terms of having parents going through a series of positive parenting, and I know it is not exhaustive because they have just done it in small scale. Sectors or sub-counties, so it has not reached out to everyone. But what I'm stressing here is that AY part special for youths, because youths will not want to go to the hospital and find their mothers and their grandmothers lining up, and then they are waiting with them. So we have those to be seen by our healthcare providers after 5. With the youths, we have Darajabili Mission volunteers dealing with the orphans and vulnerable children. We have another one called TICO. We are seeing a shift now for this World AIDS Day in this year to boys and girls. It is true. Even when a man has known their HIV status, they take long before they are linked to care. We have a policy where we are nation's targets that we have of 95% people identified, we are supposed to have 95% of them put on treatment. And so we are and the boys, even when it comes to issues of PrEP initiation, the women embrace very fast PrEP, pre-exposure prophylaxis of ARVs. The women embrace it very fast, but the men are hesitant, they don't take, such that even 55% of men who are eligible for PrEP being enrolled in the quarter April-June. We have talked about a higher proportion of men who interact ART. That one came out clearly. Why we should concentrate on men and boys. Who are the perpetrators of STDV? Mostly, they are men. That's why we are also concentrating on men and boys in this year. Men community, I'm sorry to say, Keti County, it's like we have really encouraged issues of incest, we have encouraged issues of sort those things, and we've just finished about it. So that's why this year, even as a county, we really need to look at these boys and men. If they have to do well in all aspects of health, then the boys and men who are the perpetrators most times should also, we should have programs that are addressing them. The other issue, girls is higher than the boys. More girls are transitioning to secondary school, and the statistics are showing that the girls are at 79. I just wanted us to have these key issues so that we discuss around them. And then, what about alcohol, drug, and substance abuse who are engaging in the using of drugs? And then the jailers also predispose them to other issues in the cells. So I just wanted to just give an overview so that we concentrate on. Thank you.
And I think, yes, I come to you. She has really emphasized on the theme of, and we all agree that this message needs to. And I'm thankful to our sponsors, Keti. And we hope that I saw some hands there, Marwanga and your friend there. There is someone here. Yes, nimekuweka sana.
Okay, thank you, Kevin.
Yes.
My name is Oguru Waseko. They're struggling to catch me. Okay, thank you. Working in the human rights field, on the issues of stigma and stigmatization, these are things that are real. For example, I went to a home in Maran area, and this young man who told me, Oseko, my father is telling me hawezi nipatia shamba sababu I'm HIV positive, so mimi ni mfu ambaye nangojewa. So when I was listening to this, I was like, so after all this time that we've been doing HIV/AIDS awareness, fighting stigma and stigmatization, still we have a section in our society that feels that once you are HIV positive, when you move to nangojewa kukufa, which is very wrong, very wrong. And I asked him, and luckily I had time to sit down with him and ask him, from the time you were diagnosed with HIV/AIDS and with HIV virus, how many funerals have you attended? Akaniambia mingi sana. Na hao wenye walikufa wote walikufa HIV? Akaniambia hapana, wengine walikufa accident, wengine old age, wengine walikufa tu hivyo, wengine walikufa COVID. So I was like, now why do you want to accept the labeling that your father has labeled you? So those of us who are working in the areas of a long way to go. The other thing I want to talk about is the gap between the young men and aspirants. Majority of us who are seated in this room, even those even the panelists, we are almost of the same age. And you can agree with me, the way we were brought up as young men is not the same way we are bringing up our young men. Our dating arena then was so different. If, for example, I was dating my sister here, sometimes I'm going to twist so that we build resilience. But nowadays, for our young boys here, our young men, the dating arena is like kuna simu hapo, kuna WhatsApp, kuna you know, the dating ilikuwa this. I remember during our time we could even walk like 20 kilometers to go and meet a girl. Na unafika kama umefika kwa meeting point, then anahepa akicheka. So it was fun. So it had some toughness of being men. Sometimes kuachwa, those of us who were in high school those days, unaandikiwa barua ya kuachwa una tissue paper. Sio siku hizi unaandikiwa message.
In their rooms and observe after 2 weeks. In a status quo that my child is okay, my ama what is influencing some health-seeking behavior of our men in our. And sometimes there's factors we call symptoms misappraisal. Then I will say, this is just malaria. Let me move on. Men tend to develop unhealthy coping mechanisms. So,
most churches and church leaders take sex to be sacrosanct. We are active and they are aware of this. So we need not to condemn sex education in churches. But Stella Nyanzi of Makerere University was coming out and telling the public that I'm teaching my daughter how to. Our children know.
Kisi Poly, we have also been a representative for youth. Kama nimepita before youth. But today I want to talk to parents. So how are youths wetu? We have left them in between here. Hakuna mtu wa kuelekeza vizuri. That's why you'll find that LGBTQ community. Unapata wewe kama mzazi umeleta houseboy in the house. Akishaondoka haujui, unasema mimi kama mama nikiona wazee wanakuja kwangu sina shida nayo, lakini nikiona wamama wanakuja ninajua wanakuja akabakisha moja kwa mfuko, si yeye nyumba itakuwa vita the all night. Unafaa kushukuru because anatumia protection. Yes, we want zero new infection by 2030. Whether we like it or not, hawa wanaume wakishapata skati mpya huko nje, ni wako mkiwa naye kwa kitanda, akiondoka ni mali ya umma. And that is why bado tutakuwa na all infections in the coming year. So me as a woman, we keep prepare my husband in the morning, lazima nipatie some. Anafanya nini? Anatumia. And then you are tracking. Unatoka mbali kwenda shuleni ambao unasoma. So when we as parents atuwapatie na pocket money, kuna huyu bodaboda yeye atakuwa anakubeba na kama tu mwambie hata jana nimetestiwa jana nikatani HIV positive and that's why I'm carrying. Any man when na common sense ile nzuri akishasikia tu HIV positive, even that even continue erecting. Sitalala. Yeah, so tunasema always beba condoms kwa mfuko yako, tembea nayo, try kukuwa na negotiation skills at least as we have this issue of HIV. Asanteni sana.
Makofi kwake. Saying it as it is. Ni sawa. Asante. Now I hope those who are leaving the room are going to get tested. So tutakaunti wale wameondoka tuone kama wamepima. Na wewe kama unaondoka pima alafu rudi ukae. Si ndio? Bwana Henry anataka kuongea lakini huyu wa connect na wewe aongea alafu tuende kwake nirudi hapa mbele. Okay, sawa.
Good morning. So I'm a student at Keti University. My name is Constance. I wanted to challenge the youth. Then I have one question to the panel, one of the panelists. So when you talk to most of us as you that discussion in it, most people say that their parents have not given them the sex education or the sex talk, or they cannot talk to their parents about these things such as HIV and AIDS. And then my question to youth is like, yes, of course, this is something I will be doing, so on and so on. And so my challenge goes that start now. Because there are people in higher learning institutions, they're at home, there are people who are looking at Keti, or maybe you're on a panel like that, it's so easy to talk about that. And then my question to the panelists goes to Dr. Lucy. She talked about women die more and mentioned a very interesting aspect of homosexuality, experiences that can be shared as case to the same. Thank you.
Yes, with respect, I think
Kebabe Anthony, I'm a student at Keti University. Yeah, I'm a mental wellness activist and also a few questions and also I'll also challenge the young people in the building. First of all, I'll challenge them. Stigma, sisi wenyewe ndo tuanza na hii stigma. For example, utapata nakuja kuna story ya friend ama person alikuwa tested na negative, story zake zenye ni mgonjwa, talking ill about them. So I think sisi wenyewe the Gen Zs crowd, alafu tunaanza kuassume sisi ndo tuko stigmatized. My first question is cases. For example, gender equality it's not only women. We find that the LGBTQ communities were included us, and the GBV whatever, and men are to report. The system of administration. And then another question is what are the kanisani, for example, in churches, huwezi pata mtu yote mwenye amepata mimba ama AIDS unakuwa considered a sinner. First of all, you broke the laws of the adultery. You should not engage in in sex. They can address us accordingly. And the last question is the supporting mechanism. My brother, the prep, the activities. At the end of the day, what next? We should answer the question, but it's good that just sexual activities. So we should come and Kesi and the Low Trust Initiative. Somebody said that kuna Article International. We need to draw, paint, and to keep going each and every day that nikona kitu nafaa kufanya. And also it gives me a chance to pass my activism of mental wellness and GBV as a young person. But kwa wale wenye hawajui hiyo, what can we do to put them on board? Because also pia mimi najiendeleza, siwezi manage to cater for each and every person. Yeah, thank you very much.
I think the question has become really, let's just address some of the issues raised and then we move to this side.
I think the question I've gotten from you, your concern is how SMOH. So, the public health in Kesi County, we do hold quarterly meetings where we are bringing various stakeholders, the police, the advocates of the High Court, the magistrates, the status, whom the wangapi wamepeleka. So we are trying to address these issues the way they are supposed to be addressed.
So thank you. On the issue of gender-based violence, as the introvert, we've done a lot. Work closely with the human rights defenders in this house who have had some of our cases that we give to them. We work closely with the paralegals. We work closely with the pro bono lawyers. We have pro bono lawyers who give pro bono services to the affected population. We also do what we call referrals. We network. It depends which case it is. For example, if it's a 14-year-old girl who is pregnant and we need to pursue that case, we have safe houses where we take them. If it's within Kisi or even outside Kisi, we have some network where we network. And also we have the component of prevention. And that's why in fact we are here today. The component of prevention. How can we prevent? What is my role? What is your role as a youth? What is your role as a mother? What is your role as a lecturer in Kisi University in the prevention of all these forms of gender-based violence? And then I want to talk to Otieno. Otieno, you mentioned something on how we can empower our young people. In fact, we've done that. You mentioned an example of Lucy Girl Power. We've trained AYPs, adolescents and the young persons who are our champions in different institutions. We've trained. If it's in Kisi National Polytechnics, we have champions who we've trained. Kisi Youth Wellness Center. That is where we have you people, where we can engage. So I call upon every stakeholder, hata kama ako hapa, hata kama hayuko hapa, so that we can work together. And if we end GBV, then we're here in the right trajectory of health. If we end GBV, then we reduce even the teenage pregnancies that all of us have mentioned in this hall. Thank you so much.
I want to support the young people, and my colleague who talked about parenting, and talk to the young people, to our children, because we give the right information. I know in our society we do not have maybe many organizations dealing with parenting, empowerment skills. If the county can also take up that, I want to throw up that challenge to the county also. Please take it up, but also bringing up parents in challenging times. Two, in the university we have various programs. I know they may not be satisfactory, but we always try our best. If like now we are talking about HIV, this is a program that I actually expect students to turn up, and we have a hall, but you see even up there we still have spaces. So I want to urge students, young people, activities, and I have seen the dean of students in the house. I want to tell us what programs are there with our colleague Edgar. I know they do a lot of stuff with students back in the fairness, and therefore my colleagues who work closely with students, maybe you could also tell us what is, but I know they are there.
Thank you, Daktari. The dean will talk about the programs, but I would just like to ask. I don't know if it's going to be answered, but I'm curious how the gentleman who was speaking earlier, and he gave, I feel we are at a nexus of change. We were here maybe 15, 20 years ago, and the next, especially the nature of Kenyans, there are things we don't talk about, and we just bury our heads in the sand, and but they are happening. They are covering us. They are affecting us. They are affecting our young people. The rise of the DMAC, before I hand over this to the dean, just point out one or two programs that we're doing. It's double trauma, and it's double problems, and it's double shyness to someone who is in the LGBTQ community getting harassed. Because one, admitting you were harassed, or admitting you were raped, or sexually harassed is first of all a problem. Now, consent is double problems. And if we find ourselves, it's not a conversation we have often. If you actually open your ears and listen to these young people, these things, when we begin to know about it. Because there's a time, if you had it.
Let me pick it from where Dr. Ross handed over the mic. As an institution, societies registered in the office, they are professional, they are in service, none that the reaches it is not lack of information, it is not lack of speaking, it is lack of being over 25,000 students. How many are seated here listening to this? Very important. Now, getting our students or our young generation out of their own, they are busy doing their things. They are busy, despite all that is happening around us. Once a person, Mr. and Mrs. Keti University, have got a forum, Jikubang, and they are talking about self-love. You will accept who you are, you accept your weaknesses and your strengths, you are and you're looking or seeking out how to get out of it and how also to impact others positively. Because then, programs. But we are in our rooms, we have chosen to go to negative vices. So we are encouraging our young generation. And even this generation gap, it can be that the generation we grew up, these things were not there. They were handled differently. And people took them differently. Even has been here for decades, and it is still affecting us. Why? It is because just once, the next day, you will not find them. They shall have gone, they know here there is everybody else apart from us. So I'm throwing the ball to ourselves. And that as individuals, there and challenges are there. Let's be deliberate and choose to do that which is right. Base, and he gave us a conscience. Here, they are out there doing to do what? To fill this gap. So as young people, as old, as a gap, be deliberate and try to fill it. So we have empowered the ladies, the men are on the edge and they are suffering. Yes, we are wired differently, even psychologically. I have a man in my house I've lived with for more than 30 years. Even a call, Homa, kuchukua, say you can mix a concoction and take, even before you do what? You go to hospital. My God, even that one alone. Now, what are we talking about? Now, taking the regimen. Keeping that particular time you're supposed to take this medication and do all this and all. They're wired differently. And that is why, when you are close to a man, you come in to fill the gap. Thank you.
Thank you so much. Well put, Makofi Kwao. We are almost finalizing. We have less than 10 minutes. I come to you. Yes. I'll before you do. What the gentleman Edgar said that we have misconceptions about HIV. Now, my question will be medication available. Has this information and medication made us careless? Has it? But another challenge that we need to look into.
Thank you so much. There was a question on men having sex with men. It is true. Research, and they have found the easiest way to get kwa ajili ya wale pengine wamefanya utafiti na wamepata, ukitaka kufikia wale wanaume ambao kuna wakati tulikuwa na mkutano, kuna mtu anawafuatiliaga, kwa hivyo the county has the statistics, ni kama idadi ngapi ya wanaume hapa Kisii wanakuwa na ngono, kwamba wanaume kweli wako haraka kujia, ili tuambie kwamba hata wao ambao wanakuwa na ngono wanaume, ili tuambie wako at a higher risk. So we need to reach out our men and now. Sio rahisi sana kwa mwanaume kusema ninakuwa na uhusiano na mwanaume mwenzangu, hata kaniletee kiume kingine aniambie ndipo anataka kuoa, nitapinga. Lakini tunasema wako pamoja nasi na lazima washughulikiwe. We have to think of a way forward because we are thinking about somebody from the county will handle on that. But I want to talk about something about this stigma in men. Wale tumekuwa katika kupima mwanaume na mwanamke jinsi how they react after they turn positive, it is quite different. And we allow them to cry. And even after counseling, you'll find most of them will cry. But there are very few men who will cry after they turn out to be positive. And I would want to ask Dr. Rose, how would men be helped also to cry? Because crying also is medicinal. Can men also be taught to ventilate by even crying? And then I have this other issue of men. If a man goes to the hospital and tests and turns out to be positive, and the wife turns out to be negative, what is normally the reaction in the community? Si huyu mwanaume anatangatanga sana ndio sababu amepata ukimwi, si ndio? So somebody was asking, is stigma still there? So stigma is still there. And in the church, we have a few of them in church and we know them. When a woman says she's positive, and when a man says he's positive, the way the community looks at them is quite different. And therefore, boy child is still having a lot of stigma in the society. How can we help these men? Even when they get medication because they are positive. And maybe most women will go and talk in a chama, where women go to ventilate. Women have got a lot of areas where they can go to ventilate. Unaenda chama, unaongea na wenzako. But how many men are able to share this information about even their sexuality with other men? So you find men are going to drink, ili release tension, sindio? So I think we still have a lot that we can be able to do. Our son there was saying that we don't have the youths to represent them. The Dean of Students did say, educate us, and we give them a lot of all week with them, we have trained them, we even have counselors from the Dean's office, so information is out there, let us go for it. And I've given to society. I want someone from the county to talk about men having sex with men.
We really don't have time. We don't have much time left. But because we at 11:59, I was supposed to stop at 12 sharp. So I only had 5 minutes. Na wale wengine ambao tuliuliza mko mnakunywa chai, naambiwa kuna chai ya kuja, usitoke.
Sasa swali ambalo limeulizwa, let me confirm to you that we have a population program in Kisi County which looks into the welfare of our people. And this program is meant to reduce the HIV transmission between the 6,538 female sex workers. But according to the program, we have surpassed that population size estimate to a tune of around 12,000 female sex workers. For the men, MSM, men who have sex with men, the estimates gave us 737 as the estimate supposed to be in Kisi, but we have surpassed that estimate. We are in Kisi County. We also have another category of people who get with the drugs. The estimates gave us 36. We are somewhere there. And then there is another population called transgender. The estimates also gave us 63. So as a county, we have that program to ensure that even as they mingling with the general population, there is a reduced transmission of HIV. And that's why that program is there. We're working with other implementing partners within the county. The Ministry of Health is working through NASCO. And again, we also have NSCCC as the overall response. So in every sector, we have an AIDS control unit. Even in Kisi, we have an AIDS control unit in the institution. And that's why we have clubs, we have societies. In the county, we have networks of people living with HIV/AIDS. We have we have bursaries for the vulnerable children who cannot go to, giving support to the young and vulnerable children in the county.
We are penalizing, but there were questions there. I don't know. I don't think you have a chance to. Madam Flores, Madam Flores, I thought akaona kuna semester ya I thought akaona kuna semester ya kufikiria kuna ukimwi na akaanza kutafuta dawa penetrative ukimwi na akaanza kutafuta dawa
penetrative sex. Again, the anatomy is different. The epithelial lining, the anatomy is different. The epithelial lining of the will always get tears and tears and therefore it is because I may not have a chance to speak again, let's understand that the donor community, that funding is going down. The donor community, that funding is going down. In future, we are not going to have that funding. It can prevent or end HIV as a public health problem. Let's make use of that information. Even these youth, I had the dean of students saying you have very many classes. Google. So make use of that information. And let's prevent HIV. Whether the availability of drugs and all this is leading to the the aim of our program is to the final outcome for those who are HIV positive is to misbehaving positive is to misbehaving around, then they are not transmitting the news. You know what is PEP? What is PEP? Unfortunately, our youths are engaged. our youths are engaging in the extent that KTRH, our biggest referral hospital, is leading in the use of PrEP in the whole country. Nothing wrong for us, use of PrEP in the whole country. Nothing wrong for us. We want to prevent the infection. We'll still give you the PrEP. But please, for those who use the PrEP. But please,
for those who have not had an opportunity to speak, to just have one.
Continuously, just come for PrEP. Then on STIs, sexually transmitted infections. You know, even HIVs are sexually infections. We are doing syndromic management. And the only way, if one has any symptoms of our hospitals, we have private, we have public hospitals. You can be diagnosed and you can be put on treatment. But for HIV specific, do not diagnose. Testing. We even have the HIV self-test kits, which can be given. Come to the facility for further confirmation, to the HIV testing centers. We have so many. HIV diagnostics centers. And apart from testing, you're tested, you're put on treatment. So we are also using treatment as for prevention. Because we have said you is our prevention. Because we have said you is our virally suppressed, then it means that we are preventing transmission. Virally suppressed, then it means that we are preventing transmission of HIV. Thank you so much.
Kuna wale wengine sisi tunakaa tauni mpaka saa 6 na kwa sababu sisi culture yetu 6 saa 5 na kwa sababu sisi culture yetu question 2 question 2 more are these that go out during the night, and who are these to protect them because many of us were parents, we handle our children like trash. So I'm trying to challenge those of us who are in the house.
Thank you so much, Bwana Omweri Henry. Mmepewa makofi mazuri kweli.
So one of such strategic plans, the Keti strategic program, the government policies for the national and the county government. Otherwise, I'm very happy for you.
Coordinator in Matters AIDS in Kisi County. It's Kisi TV. Thank you. Yes, Secretary.
The short is that let us be responsible, test all the time, medically tested, and we think they are free. Come for medical testing.
Yes, Madam Florence.
Florence of the sentence, let us continue with our treatment. We can prevent onward transmission.
Issues to do with the men having sex with men, on how we patient attitude transformation. When they come to us, how to empower them on how to prevent themselves. Intervention measures on how to prevent the new HIV infections.
Yeah, thank you very much. I'm excited to be back here in Kisi University. But in 2014, he had just come back with his PhD, and he was very proud. From a class of about 15, only about 4 months graduated, because he went ahead and asked us to get him the raw data that we had. He went to the SPSS. Actually, the correct things, and most of them failed. So I'm very happy to be back here. And thank you for showing public health problem by 2030. And the Ministry of Health cannot do that alone. So my part, everybody, that please go out there and get tested. Everybody, that please go out there and get tested if you are not tested, and do it on a regular basis. Right now, we are telling you, once you are test positive, find out whether you're positive or not, and take guidance. For the youths, remember you are our future. After being tested positive, it is not a death sentence. Thank you.
I'm happy this morning that we are talking about HIV and we are bringing on board discussions. It's not a death sentence. And it means that a person who has had a diagnosis of HIV may feel stressed, depressed, those mental health conditions that may come with bad news. Having a mental health problem can actually predispose someone. It's a risk factor for getting HIV. For example, using drugs can actually predispose somebody to because there are some drugs that are injected, that method of injection. If you use unsafe ones, and of course, once you use alcohol and other drugs, poor judgment. So you may not make the right decision about your sexual life. And my parting shot is that mental health is very, very important whenever we have a conversation on anything. So I want to urge all those who have attended today, seek out service. You know your status and you are feeling stressed, we are available. Finally, I want to ask the county to really integrate the screening of mental health testing. And so that clients who come for testing also receive mental health support. Otherwise, in this county, I'm always at the forefront for advocating for mental health, and also in PC University. Let us embrace mental health all the way, right from home up to the community level. Thank you.
Thank you, Daktari. Situwapigie makofi tafadhali. Great honor to have you, our panelists, na umetusaidia sana kuelewa haya masuala. Na finally, I thank everyone. Kisi and the Trust Initiative, partners, the member CSOs, and all stakeholders who are represented here. Thank you so much. As I invite forward for a closing remark, but I must indicate that we were able to be here because of Keti and USAID, Keti itself, KCDF. We make we do it on behalf of the DVC who left. He's a member of the AIDS Control Council and also a lecturer at the
I want to take this opportunity to appreciate each one of you here who have come here today. Specifically, Keti, for recognizing that we are the higher institution in this region that we should lead from the front. I want to appreciate all the panelists who have just given us what it is. The members who have particularly brought out everything black and white. It has not been easy. Some of us who were born in the 70s, we are called Generation X. We saw how stigma was stigma. I want to tell you it's no stigma nowadays. The plate you could use eating when you are HIV positive, it was thrown out. Share it with you. Let us come out and do it. Committee of Keti University, thank you. May God give us that energy. I want to tell you, test yourself, go to the hospital for confirmation if you fear. Blink your left hand. Normally I blink this finger. I blink this finger is safe than all other fingers. Blink, then go confirm. I'm telling you what it is. It's not a job to test. It has fear. Even those ones who know that you are not having it. Take a bold step. Let's walk out and test. Is that okay? That's when we can prove we have received the best. Thank you very much, Captain Omayo Francis, a committee member, Keti University AIDS Council. Asanteni sana. Biamono erokamani.
Asante sana. Do we agree that all of us are going to test? Wangapi hawata test? Center and also founder of Tuesday TV. We have Getamba TV, we are live, and we will also show some of the clips later in our station and in our news. Thank you so much. I appreciate the opportunity. Now, because you're the reason we're here, kindly you can also do
Okay, my name is Joseph Owema Osemba. I'm the Secretary General to KSUSA. Most of us had classes, that's why you never saw maybe a larger group coming. But as we continue championing here about AIDS, they fear coming here. Maybe you can organize with them so that they reach out even when they are.
Yes, thank you so much. So my name is Asha again, Moronya. I'm the programs coordinator for Keti, especially in giving logistical support. The university team, our partners in the plan. So tunawashukuru sana participants in this session. Musisonge as the rest of the panel probably move to some other section for slot arrangements.
Yes.
When sort you out with some refreshments, and there are those who are invited also by use of our text. After wengine mumepatiwa soda na use of text, mutabaki nyuma. We'll have some session with you once again. Thank you so much and God bless you.
Yes, to add on that, tea that is available for the panelists and other partners tonight access. Yes, partners from the AIDS control, the leadership,